So these are the considerations. We know that it's incurable. There's a loss of function. It's rare. And the viability of the tissue decreases with time. So there's going to be a window of opportunity with which to develop a treatment and deliver a treatment, which has surgical implications and implications for the design of a clinical trial and predictions for what the ideal treatment will be. So proof of concept was first established for treating choroideremia several years ago, in fact, around 2003. And this was done in cells in a petri dish in vitro from individuals. These are cells donated by individuals with choroideremia. And this is a collaboration that my lab did with the lab of Miguel Seabra. We used the virus that was available at that time called adenovirus, cloned the normal choroideremia gene into this adenovirus, delivered it to these cells, and we showed that we could restore this biochemical activity, which is what this graph on the lower right shows. So this was a good start, but the adenovirus is not an ideal vector for moving to humans because it causes an inflammation and it induces an immune response. So we and others are planning to move forward with a different approach, a different reagent for a clinical trial. And this slide shows what our plans are. Our plans are to use a reagent that's based on what's called a recombinant adeno-associated virus vector, or AAV. And we have previously used an AAV for the study I showed you about the one with the child who can now essentially lead a normal life after being born blind. And this is a vector that has a lot of experience in human clinical trial. It's been used in multiple different inherited diseases, including hemophilia and muscular dystrophy and others. So there's a very high safety profile. And we're planning on moving forward with that. We're also considering joining forces, either in addition, possibly in addition with running our clinical trial, with the UK group to establish a site for their study in Philadelphia. This is complicated because we can't just accept their vector and start injecting it. The U.S. Food and Drug Administration, FDA, has a very strenuous process for approving of drugs. And the approval process of the FDA is much different than the process that occurs in the United Kingdom or in the other European Union countries, or for that matter, the rest of the world. In fact, I think it's much more rigorous. And so there are some issues with being able to set up that site in the United States and be able to move forward there. But it's certainly something that we are looking into, so stay tuned about that. But regardless, we are going to move forward with our particular reagent, with the priority being we want to develop a treatment in the fastest and safest way, and also the most economic way.